Myself, Dr. D K Rao. I am an orthopedic surgeon. My educational qualification is I am MBBS, D Ortho, and MCH Ortho. I am working in the RB Rao Memorial Multi-Specialty Hospital Private Limited that is situated in the Gonda district of Uttar Pradesh of India. Now I am going to present on the topic avascular necrosis. This is a very common topic nowadays. That's why I am discussing over there. In the recent era of the COVID, the new thing has emerges in COVID patient as a post-COVID symptom, that is the bone death of the hip in layman language. In medical language, this is called as the avascular necrosis of hip. This is defined as cellular death of the bone component due to interruption of the blood supply. The bone structure then collapses, resulting in the destruction, pain, and joint space narrowing. AVN can be associated with multiple other conditions. This can be occurs because of the loss, single massive interruption of the blood supply, yeah, or it also may be due to the small multiple losses of the bone. The avian occurs the bones which are have the peculiar blood supplies because like that they are have only single blood supply or they have little collateral circulations. This bone may be the head of the femur, femoral condyles, head of the humerus, capitulum, proximal bone of scapula, that is carpal bones, and talus and nulent. These are the bones have the peculiar blood supplies. They have less collaterals. In the stress conditions, they are not able to maintain their blood supply. Then I first want to tell the symptoms of this. Patient generally first complain the pain in the hip region, and also maybe the pain in the thigh, the middle aspect of the thigh. It can also radiate up to the knee. The most important part in avascular necrosis of hip is that pain may not occur in the hip area. I'm talking about hip because the hip is the most common joint which affected by the avascular necrosis. That's why my main focus is uh, around the hip of avian hip is. Most important thing though I want to tell that the key in avian of hip, patient may not have the pain in their hip. He can complain of pain in the back of the thigh, front of the thigh, and medial aspect of the thigh. And most common diseases nowadays that is the back pain. Back pain sometimes associated with the radiating pain in the thigh. In that situation, most of the avian cases are missed because most of the clinician and patient shows that I have some problem with the back which is radiating in my thigh and the disease is missed. And thing is that's why important that only stage 1 and 2 of the this disease can be reversed. After stage 2, this avian can't be reversed. That's why early diagnosis of the avian is the most important part in this case. Then I want to tell some important risk factor which causes this disease. That is the most important cause is the trauma. Post-traumatic cases that may be fracture of neck of the femur. It may be due to dislocation of hip. Yeah, this may be other injuries around hip can cause the avascular necrosis of hip. Sometimes irradiation because of the cancers. It also may causes the hip necrosis. Most important cases seen even in the alcoholic. Alcoholism, chronic alcoholism is also a very common cause of the avascular necrosis of hip. And the steroid use that I also seen in this COVID era is that is the large doses of steroid has been used in the COVID patient. Steroids are also used in the some diseases like arthritis and lung diseases. The long use of steroid can cause this disease. Some congenital diseases like sickle cell anemia, hemophilia can also lead to the this avascular necrosis of hips. Hematological disorder like lymphoma, leukemias, that Gaucher's diseases, this SLE, this can lead to this diseases. But the most important thing which can we can consider in our day-to-day life is the alcoholism. Alcoholism, chronic alcoholism that is associated with the avian, that wants every alcoholic to about this disease. Any alcoholic, chronic alcoholic, if he feel a pain in the anterior thigh or hip area, then he should be aware of this disease. Then I want to tell something about the other diseases which can mimic the picture like avascular necrosis of hip. That is lumbar radiculopathy that I've talked earlier. The lumbar radiculopathy is symptom of lumbar radiculopathy is mimicking the avascular necrosis of hip. Spinal stenosis is also mimic like avian. Neuropathies, myalgia parasitica, that is pain and burning sensation in the anterolateral aspect of thigh, can also mimic avascular necrosis of hip. What can we do in the avascular necrosis of hip? I want to tell the stages of this disease. There are the 6 stages in this disease. 1 to 6. The staging was done according to the severity of diseases. Stage 1 is the early diseases. In stage 2, there is some advancements of diseases. This classification of diseases is done in 6 stages. The importance of this staging, only after stage 2, we can see this disease in the radiograph. In plain radiograph, early stage 1 and 2, we can't find the disease. When we can go to the clinician, the question is that when we are the normal population aware of this disease, and when he should consult to the physician. When first he should think are any risk factor is presenting that patient. Is the patient is alcoholic, have history of trauma, a patient is any congenital diseases, and after that he is feeling a pain in hip or that area, he should consult the physicians. In the plain radiograph, it may not may be normal. Then the only MRI, which is the gold standard of diagnosis of avascular necrosis, if that can find disease in early stages. Staging is early diagnosis is key of treatment of this disease. Diagnosis is early, then only can you treat this disease. Early diagnosis can be done if the patient awareness is high. Then patient awareness can be done by the education of the patient. The education is that if any person have the pain in described area, should consult their doctor. Their doctor should first go for the plain radiograph. If the plain radiograph is normal, then he should go for the MRI. MRI can find the disease in early stages. Then I am going to the treatment option. The treatment option is early stages. We give some bisphosphonates and nutrition support, and there should be avoid the risk factors. Like if the patient is chronic alcoholism, stop the alcoholism. If patient is taking steroids, he should taper down the dosage of steroid, like this. In the stage 2 and further, you can go for the core decompression. In that, the area of necrosis of necrosed area of that hip drilled by drill, and core decompression of necrotic area is done. In the further advanced stages, after the core decompression, vascularized fibral graft is placed in place, and that will improve the vascularity of that area. One new thing I want to say that in nowadays newer treatment of the stem cell is done in the early stages, which can do better in the early stage patient, in which after the core decompression, the bone marrow stem cell are introduced inside. the decompressed area. Then third, in the advanced stages, resurfacing hemiarthroplasty was done, and this can be worked in the early stages. And then if the avian in the last stages, then the only treatment option, that is a total hip replacement, is there. That's why I'm summarizing the thing in few words. That this is the very rare disease, and avascular necrosis of hip can be only prevented, can't be cured. That's why prevention should be the first line, and prevention can be done by reducing the risk factors like alcoholism, patient proper care during the trauma, reducing the intake of steroid, like that. And second thing, early diagnosis. Early diagnosis can also be very helpful in the avian patient. Early diagnosis can be done by early patient awareness towards the disease. That is, any continuous pain to the hip, hip pain in the anterior thigh, posterior of the thigh, related to the knee. So in that case, a patient should immediately contact to their doctor. And third is for the clinician, if a high level of suspicion about the patient, then he can go for the MRI. And early treatment can cure the patient of the avascular necrosis of hip. Thank you.